Okay, I'd like to welcome everyone to the National Hispanic Medical Association's quarterly COVID-19 briefing series this year. We've been going strong since May of 2020 with sharing information about how our network of healthcare professionals has been really having innovative ways to deal with the COVID-19 pandemic. And we're going to hear some exciting news today because COVID-19 isn't over yet. And we are actually seeing increasing need for vaccinations among Latinos in certain overlooked hotspots. And for today, we're going to have speakers primarily from out west, the Western United States, from California to Arizona and New Mexico and Colorado. And I think that we're going to have some exciting information here. I want to thank our sponsors. Of course, we do get sponsored by the Centers for Disease Control and Prevention for our Vaccinate for All campaign. And we're also sponsored by AARP, the Lovelace Health System, and Latina Strong. This is also a CME sponsored event. So we have a learner notification here. To claim your CME, you have to go to the URL there at the bottom of the screen. And the objectives are to determine what factors have played a role in lagging vaccination in certain states, and to learn strategies for increasing vaccination uptake, especially in vulnerable communities and Latinos. In terms of disclosures, I didn't see any disclosures. In terms of housekeeping, all participants' microphones should be muted. Please feel free to raise hand feature to be unmuted to ask a question, or type your question in the Q&A box below so that we can answer the questions at the end of the session at around 8 o'clock or 8:05. Please fill out the short post-webinar survey that will be emailed out after the event, also known as a QR code at the end. Raffle prizes are available upon completion. Recording will be housed on the NHMA website, which is nhmamd.org, and sent out 1 week after the event, along with instructions to claim CME. The recordings are for all of the COVID-19 briefings are all on our website and also on YouTube for National Hispanic Medical Association. Next slide. So the case and vaccination rates by state and county are kept by the CDC and by the states and others. And we just wanted to showcase here that in California, Imperial County and San Joaquin County have large populations of Hispanics. And when comparing the two, 38% of Hispanics are fully vaccinated in San Joaquin County, with 55% unvaccinated, while Imperial County has 70% fully vaccinated with 20% unvaccinated. And that's just to show differences in a state. But as you can see throughout New Mexico has a vaccination rate of 58%, while Hispanics make up 71% of the population. Sorry, there's two different cities here. Mora County has a vaccination of 57% with a 79% Latino population. And then in Rio Arriba, New Mexico has a larger population, 71% again, but only vaccination rate of 68%. And in Colorado, Otero County and Adams County both have Hispanic populations of over 33%, with Otero holding a vaccination rate of 50% and Adams holding a vaccination of 70%. So a lot of variation in our states, but these states all have a problem that they still need a lot more education to our communities about the importance of vaccinations to decrease COVID-19 impact on our communities. Next slide. So talking to us today from New Mexico, we have 3 speakers: Dr. Vesta Sandoval, Chief Medical Officer, Lovelace Health System; Dr. Denise Gonzales, Medical Director of the Presbyterian Medical Group Neuroscience Program; and Dr. David Gonzales, Chief Medical Officer. And I'm sorry about that last typo there, but they're all from New Mexico, and let me have Dr. Sandoval start.
All right, thank you very much for the invitation and for the honor of being able to speak with you today. We wanted to take this opportunity to talk about our New Mexico pandemic response and the experiences that we had. First, we're going to share what the framework was and how that framework looked for our state as we put it together, so that we were trying to provide equitable care for our patients, whether that was patients being transferred, therapeutics, or vaccinations. New Mexico is a very rural state. We have limited resources and limited ICU beds. So we were very fortunate in the fact that our state had put together a emergency preparation plan. Next slide, please. This emergency preparation plan was actually put together in 2018, and it acted as a playbook for us to be able to put this framework together and work together collaboratively across the state. It had a hub and spoke model so that we could reach out to the smaller facilities in the more rural areas of the state and increase communication, be able to increase our ability to move patients or PPE or whatever that was needed across the state. We were made up into a medical advisory team, which the three of us participate on. And this medical advisory team had subcommittees, which also looked at anything from ethics to treatment to therapeutics to vaccines, and helped us form a framework to be able to move these types of treatments across the state to the smaller areas of the state. So now I'll turn it over to Dr. Gonzales, David Gonzales.
Thank you, and greetings from Santiago, Chile. I'm sorry I can't have my face on, but I have a weak internet connection. But I want to share with you that our journey into vaccination started with the New Mexico Department of Health's Vaccine Equity Plan. Next slide, please. This is a very good 3-page document that can be found on their website. And basically, it took a 4-pronged approach to vaccine equity and allocation. It started with the first prong being equitable allocation and access, followed by organizational structure and communications for equity, followed by community engagement to build vaccine confidence, and then, of course, monitoring and evaluation for equity. Next slide, please. Our goals were multifaceted in facilitating vaccine access. The first one was the New Mexico Department of Health. They had a special site you could apply to host an event. And we found that that was an important way of helping people attend more events. It provided a safer environment for community members to get vaccinated in a location and with people they trust. So any community groups such as churches, organizations, businesses, etc., were able to request a vaccine event to be held at their location, and they received support from the Department of Health. Locally in Santa Fe, our federally qualified health centers in Santa Fe were key in helping us institute those events. Another one was the Department of Health vaccination events utilizing a FEMA urban mobile unit. They were the first mobile vaccine units of the pandemic that the Department of Health did. And they specifically went to border Hispanic communities and zip codes with high Hispanic and Latino populations. They're no longer using these, but they've switched to other ways of delivering vaccines. Community health worker partnership, that was a very successful one. We had several summer interns in 2021, all Spanish speaking, that helped create a specific workbook for community health workers across the state to reach out into those hard to reach areas to help people. They had a 73-page flip chart that's been edited and re-edited with time and updated, and they're still being used today. These community health workers continue to have biweekly Zoom calls in which the DOH guides them. And as a result of all this, our vaccine efforts were among the top in the nation, as you can see from the accolades received. The picture up on the top right is actually early on, the Department of Health had an app that we noticed the Latino groups were not using as extensively as we had hoped. So me and my colleagues on the call tonight actually instituted a registration process for everybody, especially Latinos, to be able to come to our sites and register, and then they'd automatically be enrolled in the program and recorded in the New Mexico State Registry. Next slide, please. This is just an example of the community health workers flip charts. That was 73 pages long. You say it had table of contents. These were some of the partnerships that they formed through the Community Health Worker Initiative at the University of New Mexico. One was the consulate in Albuquerque. Another is Casa de Salud, which is a integrative primary care center in the south side of Albuquerque. The Conalma Foundation is one of the largest health foundations in New Mexico as a result of Blue Cross Blue Shield pulling out one of their products. Hispanic Cultural Center, and of course there was a New Mexico coalition to enhance vaccine equity among Hispanic and Latinos, and this was made up of several groups. Next slide, please. And the Better Together grant enabled people to apply for a grant. Community organizations could apply for funding to educate their target community on COVID-19 and COVID-19 vaccines. There was also an instructional video to help them apply. And so several $1 million went to as much as 12 organizations, up to $200,000 in grants to help them reach out to their communities with advertisements and other ways to reach them. This has been a newer initiative, and therefore we haven't seen the results of it just yet. And now I'll turn it over to my colleague, Dr. Denise Gonzales.
Thanks, David. If we can advance to the next slide, please. You know, information is so important to reaching diverse communities, and we had to use alternate channels and not just traditional channels. So there were several community leaders, including clinicians, who served as trusted voices throughout the pandemic for our patients and communities. It just so happens that in rural New Mexico, water boards are actually the way to reach communities. My mom has served on a water board in Doña Ana County because I grew up in an unincorporated part of the state. And she served as a trusted voice as well. So it was a very diverse community of people who served as trusted voices. The three of us, Dr. Sandoval, Dr. Gonzales, and myself, as well as other physician leaders, appeared on local media, what felt like to me almost on a daily basis, providing up-to-date information on various networks. And this included Spanish language networks. I came out on Univision a few times. We conducted Facebook town halls where questions were fielded in Spanish and answered in Spanish by various specialists. We had pediatricians and OBGYNs come on to talk about COVID-related issues in those populations. And lastly, there is a big project that we worked on, and it's an example of a partnership between Presbyterian, STC Health, and the city of Albuquerque, who sponsored a documentary regarding vaccine misinformation. I'd like to share a couple of clips with you. If we can go to the next slide.
You know, I think we've forgotten a lot of lessons that we've learned over the last 100 years since vaccines were developed. There was a big polio outbreak, devastating. Then we developed the vaccine and we called it cured. We were free of polio. Likewise with measles, mumps, rubella, scarlet fever.
Then we have one more clip.
You know,
so I sure hope that this crisis, that this does transfer beyond just COVID to other diseases, to other vaccines, that this allows us to have higher rates of hepatitis B vaccination, to have higher rates of childhood immunizations, influenza, across the board. And the same way, I hope that we never forget the the pain that the disparity has caused, the obvious shortfall we've had as a society is that, our most vulnerable folks had a much higher death rate. If you can't access just those basic social services, you're going to have a really hard time surviving a healthcare crisis.
Those are just 2 excerpts for us to share.
So
So many more. It was such an exciting project because it involved Latinos, Native Americans, people from rural parts of the state, and it really highlighted the importance of vaccination, not just for COVID, but for other diseases that I hope that we can continue to remain focused and have an impact on the Latino community. In summary, our state's response was so important. The goal was to minimize the number of deaths and to maximize the number of lives saved. And I feel like our overall plan did in fact achieve that. We're in a state that has very low resources. We have the lowest bed count per capita for regular hospitals and especially for ICU hospital beds. So we had to collaborate in order for us to save more lives. If we had each gone it alone, a lot more people would have died. And I'm so grateful to the new friends that I've developed and our deep friendships now with Dr. Sandoval, Dr. Gonzales, and many others. We used to be competitors in this small state, and now we collaborate so much more. So thank you again for inviting the 3 of us to present.
Thank you, all 3 of you. And Dr. Gonzales, what system do you work with? I Lovelace system.
Oh, no,
Christus.
I'm with Christus St. Vincent and Christus Health.
And then and Denise Gonzales?
With Presbyterian Healthcare Services.
Okay, Presbyterian. So you mentioned about the importance of the corporate sector and the private sector working together more than being competitive. I think that's a real public health message here, and the need for more public health training among, especially in the healthcare education, not only in service in the private practice, but in the medical schools. I think that's a great message from New Mexico.
Yes, Dr. Rios, it's something that the NMDOH has highlighted as something they want to continue. They want to maintain the MAT as a standing committee to advise. We've already leveraged it with a recent Ativan shortage. We've been able to leverage the MAT structure in order to get more access to some of these critically short supply medications.
Great. Well, we'll hear more from you later. So let me turn now to Colorado and Dr. Hector Frisbie, who is an OB/GYN doctor with the Colorado Family Clinic, to tell us the stories and share with us strategies that you've used to educate the community in Colorado. And let me just say, I didn't have this information on the first slide, but the CDC's overall rate of vaccination in the United States is 78%. And for the fully vaccinated over 65-year-old population, 91%, 50 to 64-year-old, 82%. So as you can see, all those numbers that I read from the different states for the Latino population were way behind. We certainly need all of these strategies to learn from. So thank you, Dr. Frisbie.
Hi, how are you? Good afternoon. Thank you for the invitation. Thank you for all of you seeing us. And yeah, when I saw your slide, that was my first comment, that was the number in the meeting we have at the end of last year in 2021. And we take this one as a challenge because that was pretty low in the Hispanic community here in Colorado. And we started working really hard. We have a program named Champions of Vaccinations. And I'm the ambassador for the population speaking Spanish in the United States, in Colorado. And we were in the low 30s at the beginning when we were doing this initial program. And then we started developing strategies, going to schools, doing web seminars, and trying to go and talk with the people and identify why the people was deciding do not get the vaccine. And we see that our worst enemies were Facebook and WhatsApp and all this information coming from this social networks. And we start addressing this one, our presentation, talking about the vaccination. And the last review we did at the end of April, that was that with people with one dose of the vaccine was 82.7% of the population was having one single dose of the vaccine, and fully vaccinated population in Colorado, Hispanic population, was 74%. We put these numbers really high. We are still struggling to have kids vaccinated, but we are having this last number that we have on May that was from 72% of the people, they have already a booster. From the 74% fully vaccinated, 72% of them, they have a booster dose, which is helping in addition to this one. And what we have been doing is working with the community to get the community informed, to know what the vaccination is, what are the components of the vaccine, because, you know, there is very specific concerns about the vaccine in the Hispanic population. One is if they are going to have any adverse effects or side effect, if they are going to have changed their DNA or their genetic information. And especially in men, they are concerned about being infertile, and which some specific answers that we need to address. And we need to keep the people educated. We also need to educate the people about the vaccination is protecting against being hospitalized with moderate or severe COVID or dying about COVID. That's what we need to address, because some people, some in our community was talking about not being infected after the vaccine, but we never said that. And that's what we need to clarify with the community. One of the strategies that we have been using is the use of mobile units. And specifically, we have been working with the Mexican consulate. The Mexican consulate has a mobile unit for it's funny because the Mexican consulate has the mobile unit, but they do not have budget to move the mobile unit. They don't have even money for the gas or whatever supplies you need. And then they start working with one organization here named Servicios de la Raza. And they start operating the unit, and they invite me to start participating with them in the vaccination campaign. And we start going to schools with mainly population speaking Spanish, pretty far from here, from Durango, from Douglas County, as you were mentioning, which is the rural area of Colorado. This is a very diverse state. We have big cities like Denver, but we also have very far places like Greeley or Longmont, or all these places that we are controlling we are having the rural population. And that's all the efforts that we have been doing, and we have been able to raise the numbers in a very significant way. And we are happy what we have been achieving here in Colorado. And that's all the information I have for you.
Okay, well, thank you very much. Let's go to our next state and our next speaker. Vito, the next slide. Let's see. Okay, we're going to hear from Dr. Trinidad Solis, who's the Deputy Health Officer, Fresno County Department of Public Health. And let me just see if I have, yeah, I have sorry, I didn't have my view on to see her. So Trini, please go ahead. Tell us about Fresno and the farm workers.
Sure. Thank you for the introduction, Dr. Rios, and good evening, everyone. My name is Dr. Solis, and I am a family medicine physician, board certified, and I'm also right now serving as a Deputy Health Officer for the Fresno County Department of Public Health. And I wanted to share strategies that we employed here in Central California to vaccinate our farm workers at their workplace. Next slide. So I wanted to share, for those who are not familiar, some statistics about Fresno County. It's located in Central California. It is the largest county in Central California, and it has about the largest amount of farm workers in the state of California. So our population is a little over 1 million, and it is predominantly Latino. So 55% of Fresno County's population is Latino. And around any given time, 70,000 farm workers are on the job. Farm workers are migratory, so depending on the harvest and the season, they can go from county to county, but around 70,000 is what our county ag commissioner has projected at any given time. And as we all know, farm workers are essential workers. They came and worked during the pandemic, and sometimes with their work settings, with the ag industry, it's very diverse. Some farm workers work in packing houses with like fruits, and others work in the meat industry. Some work out in the fields. So we knew here at the health department that we had to develop creative strategies to deliver these vaccines to farm workers. And I do want to share, I am the daughter of farm workers. I grew up in the Central Valley. So for me, it really was, I really enjoyed being in this position and able to give back. And so based off my own personal experience, and also with speaking with our community-based organizations, we were able to develop strategies to administer these vaccines to the farm workers at the workplace, because we knew that farm workers, many get paid by the hour, and it's really hard to leave work to go get a vaccine. And so we wanted to make them as accessible as possible. And we were one of the first counties in the country that began vaccinating farm workers at their workplace, and this was in early January 2021. And we began recording the numbers of farm workers that we vaccinated, because usually when you get a COVID vaccine, we don't ask for your occupation. But when we were at a certain work locations, we wrote down the numbers. So we didn't track the personal information of the person, but more how many did we vaccinate at that workplace. And so since we began doing this, we've delivered over 35,000 COVID-19 vaccine doses to farm workers at the workplace. Next slide. And this was made possible through partnerships. So I definitely want to credit our community-based organizations. We had over 20 community-based organizations that were working with us, and they served diverse populations. Some worked with the Latino community, others worked with our African-American communities, others worked with disabled communities. So really, they were diverse. They spoke multiple languages, and they were really critical in our response with educating our Latino community. And they did it in Spanish, and they also did it in indigenous languages. So I really want to credit the promotoras that helped us with that. And it was also helpful to have different medical partners, different clinics step up and help and offer these vaccinations at the workplace during evenings, and sometimes also during the weekends. And lastly, working with leaders of different sectors was very helpful. So for the first time really in our history, we developed strong relationships with our ag employers, and because of that, they allowed us, they opened their doors and allowed us to go and vaccinate the farm workers to do that. And I think it's, for us, we started having monthly meetings. We discussed how to keep their employees safe. And this is as the vaccines were starting to arrive. But we also developed an initiative where we advised them, start surveying your employees, which ones are interested. We started having our community-based organizations go and educate their employees before the vaccines arrived. And we noted that in some of the agricultural places where they received education first, about like 90% or more of their employees were wanted to get vaccinated. And there was even one farmer on the rural side that got 100% of his workers vaccinated. So we're really impressed and really saw a correlation with those who received education were more likely to get vaccinated. Next slide. And I wanted to share, not only was it important to educate the employees, the farm workers, but also to educate the employers. So this is a picture of me. It was a Spanish presentation, but we're speaking with farm labor contractors. So for those who are not familiar, farm labor contractors are individuals that hire or supervise farm workers, and they work for like a third party, like for example, a farmer or so forth. And they can have like 50 to hundreds of farm workers working under them. So we knew it was very important to not only educate, as I mentioned, the farm workers, but also the employers. And at this conference, we had about 100 farm labor contractors come. So I want to share that. Next slide. And this is another picture of a workplace vaccination event at a packing house. And I'm there in the center wearing the black jacket, but I'm next to community-based organization members. They're part of California Farm Worker Foundation. So that's a statewide community-based organization. And this is, I wanted to arrive and answer anyone's questions while they waited in line to get their vaccine. And again, we noticed that those who received education beforehand were more likely to feel confident in getting it. But also I would share the message please share this with your family members, because we found within many Latino communities, sometimes, word of mouth gets around. And then if someone in their family did it and they share it with their friends and so forth, it spreads. And as Dr. Frisbie just mentioned earlier, there is a lot of misinformation in our community. So for those who got vaccinated, we encourage them to share their stories with their loved ones. Next slide. And here's a picture again at a packing houses. So some packing houses had a lot of room for people to spread out. And this is when we're monitoring the 15-minute period after they get a vaccine. Next slide. And again, just showing the diversity in the ag industry. This is farm workers that work outside in the fields. And even then we were able to set up vaccination tents and provide the vaccines, at the workplace. Next slide. And then I want to address the digital divide that we noted in our rural areas. So Fresno County is a mixture of metropolitan and also a large part rural areas. And in our rural areas, there are some pockets where there's low broadband connectivity. So it's really hard to get any Wi-Fi service. And so sometimes when we tell the public register at a certain website to get vaccinated, it can be hard to access that. And if you have a language barrier, even harder. So we did have right there, I have a picture of individuals sitting down, and those are members of a community-based organization that are helping people register for the vaccine. And sometimes we found that if there wasn't any Wi-Fi in that area, they would enter the information in a HIPAA protected document, and then they would go to their office and upload it to the vaccination documentation website required by the state. But I just wanted to show the efforts that went into helping individuals even register for a vaccine, because that was a barrier, not only because of the low broadband in rural areas, but also because of the language barriers and navigating the vaccination website. So that was a challenge that we saw, and we tried to come up with a solution, which we found was very helpful. And we had some community-based organizations talk to the ag employers and advise them, speak with your HR, designate someone from your HR to, if an employee comes up and wants to get vaccinated, that HR person can assist them with signing up. So there's just different methods we utilize to get people registered to get vaccinated if they wanted. Next slide. And here's another method we use. Similar to our colleagues in New Mexico, we also implemented drive-through vaccination events. So again, this was at a big farm out in the rural area of Fresno County. And this farmer invited nearby farmers to send their employees if they wanted them, if they wanted to get vaccinated. And I believe this particular event, we had about 800 people get vaccinated. And we found that it was very successful, and the community-based organizations would be answering people's questions while they were waiting in their car to get vaccinated. And we even allowed that 15-minute period afterwards. So in the parking lot, and the nurses were going car to car, just making sure everyone was okay. But again, sharing that with the farm industry, we just created, we did, as you see here, with the cars, and then we also were out in the fields and in the packing houses. So we found that we were able to do all these different methods, and it worked. Next slide. And that's just another picture of people driving up to get vaccinated. Next slide. And this is, sorry, it's maybe a little blurry, but an interview I did with the Washington Post, and I was sharing because it highlighted that, not some farm workers don't speak Spanish, but some may speak indigenous languages. And many arrive from Oaxaca or other southern parts of like southern states in Mexico. And so in Central California, here in Fresno County, we also wanted to make sure that we address that. And so we contracted a community-based organization known as CBDIO, and they are statewide, but they are one of the few organizations that can speak indigenous languages. So they helped us develop educational materials in indigenous languages, and they educated farm workers, again, before getting vaccinated. And so just wanted to share that, in this article, we highlighted the great work that our promotoras or community health workers do in helping educate our public. So next slide. And lastly, I wanted to just share that, there are a lot of rural counties in California. And so I've also worked with the California Department of Public Health to highlight and answer questions from the community. So this was, I'm showing a flyer here of a talk that I gave. I collaborated with the California Department of Public Health and another community-based organization called Promotoras con Alma. And this is another one that's statewide and works in rural areas. But I think a way to combat misinformation is to put correct information out there and answer people's questions and concerns. And so, now the California Department of Public Health also does Facebook Lives in Spanish, and we answer their people's questions. So I do think, acknowledging people's concerns about the vaccines and giving them fact-based information, and that way they can make informed decisions, is very important. And so using different avenues to get that information out there, whether it's with our promotoras, whether it's physicians ourselves and speaking with our patients in clinic or through social media. But again, I think with our COVID response, what I've learned is it has to be multifactorial. So there's different ways to reach our Latino community. Next slide. And I wanted to conclude that based off everything we've learned and saw the success of our efforts, that now we are looking ahead of how can we use this rural mobile health and do more services besides the COVID vaccine. And so here in Fresno County, we do have high rates of diabetes in our Latino community, asthma, obesity. And so we want to work with our community-based organizations and again with our medical partners to educate our public, especially in our rural areas, about how to stay healthy, how to prevent chronic diseases, and do some basic screenings. And more importantly, and also importantly, is connecting them with a primary care doctor, because a lot of individuals in our county don't have a primary care home model or home to go to. So we want to connect them. And so that's really one of our goals with this project. So right now we are in the process of developing this, and we're going to seek funding soon for this. But I just wanted to share that our lessons learned, we don't want to stop there, that we want to continue these efforts and continue to develop our community health worker hub. We saw how helpful they were during the pandemic, and it really takes a team effort. And we want to standardize a little bit more of their the materials that they're learning and passing out to the public. I forgot to mention that another technique we employed was the teach the trainer model. So myself, when the vaccines were rolling out, I would work with the community health workers, answer their questions. Here at the health department, we would sometimes develop some talking points, and then, that way we wanted to make sure that we're on the same page and that our community health workers were providing correct and information, and they did it in a culturally sensitive manner, of course. So, but yeah, I wanted to just highlight the future directions that we're going based off our efforts with the farm workers here in Fresno County. Thank you. And then next slide. So I'll leave it at that. And I know we have questions sometime at the end for that, Dr. Rios. So yes, so thank you everyone for your time.
Okay, and our last speaker is from Arizona, Anabell Castro Thompson, who's the Senior Vice President of Health Equity with Equality Health, another community-based organization that we have heard how important the community-based organizations are with our public health departments.
Yes.
Anabell?
Thank you, Dr. Rios, and good evening, everyone. It is a pleasure to partake in this series. I am delighted to be here to share with you a multi-sectoral collaboration and approach that we've taken here in Arizona to ensure that we have fair and equitable distribution of not just only testing, but also vaccination. And I will say two things. The approaches that I will be speaking about today is shaped by my work with the Latina Strong Foundation, which is a nonprofit organization that works diligently in communities to improve Latino health. And it's built on the premise that Latinas are known and strong, as well as powerful agents of health in their homes and in their communities. And then also via our work at Equality Health. Equality Health, it provides population-specific healthcare models to improve access, quality, and trust in communities. And so early on in the pandemic, we feared disproportionate impact on our Latino population and also on other ethnic and underserved communities based on our expertise of addressing health inequities. And so we set into action here in Arizona. And the first thing that we created is we created, along with a collaboration of 38 other private and public sector collaborations, we created what we called a rapid community-based COVID-19 coalition. And the RAPID stood for, it was respectfully engaging the community. It was action-oriented strategies. It was going to proactively reach underserved and undertested and undervaccinated communities. It was going to provide inclusive engagement of diverse populations, and it was going to be directing resources and support into high need, high risk communities. And some of the aspects that were involved in this rapid coalition were, we were going to give bilingual public education and awareness campaigns. We were going to ensure that the community outreach and the registration assistance was done by community healthcare workers or promotoras in a bilingual call center. We were also going to provide community-based vaccination sites. We started with drive-thrus and then evolutioned into walk-in. And then lastly, that we were going to do coalition preparedness, readiness, and activation. And what I want to take you through today is some of the most important takeaways that we were able to learn along the way. I will tell you that something that was conceptualized at the beginning of the COVID pandemic changed throughout the pandemic because we were developing greater relationships, we were developing more efficient processes, and we were finding better ways of engaging Latino communities and making sure that they receive the education, the vaccination, the promotion that they received. And so here are some of the most important takeaways that we learned along the way. And like Dr. Solis was saying, that we plan to continue to implement in our communities. There's a lot of work that needs to be done from a health equity perspective. And I think the learnings from the pandemic will just help us extrapolate these learnings into others so that we can continue to meet the needs of Latino and other underserved communities. Some of the things that you'll hear here with the 5 most important takeaways have been described by some of the other panelists here in the session today. So the first thing we learned is that there needed to be extensive collaboration to reach hard to reach populations as as well as a broad coordination and collaboration. And so we enlisted government agencies, federal, state, and local. We have academic institutions that were collaborating, the private sector, community-based organizations, and non-governmental organizations, as well as nonprofits. For us, this meant a 38 public-private partnership, including the Public Health Department, the Arizona Department of Health, and the Governor's Office. We also formed allies with important community leaders who are influential voices in their community and that were supporting our efforts. As we know, many ethnic minority communities have a saying, "Nothing for us without us." And so we wanted to make sure that we were respectful and that we brought their leaders to the table and also community participants so that they could partake in the effort and we could be successful. Finally, we also worked across sectors with our colleagues in social services and in human services to collaboratively assess and address the social determinants of health, because as many on the call know, we dealt with a lot of income insecurity, housing insecurity, utilities, and food insecurities. And so we wanted to make sure that the collaboration was broad and was going to meet many of the needs that patients had or community members had. The second one was that there needed to be multimedia and cultural messaging for health education and health promotion. And this included multimodality. So there needed to be webinars. We did virtual town halls. We provided bilingual information. For health promotion and even for the process of registration, we also learned that this needed to include additional modalities. And so registration could be done via digital, it could be done via telephone, it could be done via web page, and we had print and handouts and materials. We were also using a normal or regular media channels. So we understood that Latino media is a big force in the narration of our livelihoods. And so we were utilizing a mix. We were doing Spanish radio, Spanish newspaper, and Spanish TV networks. I'll speak a little bit more about the registration process in just a little bit. Somebody mentioned not always having a registration is the best route. And so I'll speak about that in just a little bit. Our member engagement strategies were to ensure that the activities were culturally relevant, that they were linguistically appropriate, that our messaging was easy to understand, so health literacy was taken into account, that when we were sending information, it was action-oriented, and that it happened at precise intervals. Particularly when people were getting the results, we wanted to make sure that we were timely and that people were getting the information that they needed. Both, they could go into a portal and put in their information to ensure that they got it, but also if we didn't want to detract from people getting the results, and so several modalities were used. And then lastly, community resources are excellent for spreading messaging. And so therefore, we weren't just constricted to medical. There were other important sources that we used or resources such as faith, community, the legal community, and many business organizations. The third walk away for us was location, location, location. Community events are best accomplished in places where people normally access information and when it's proximal to where people live, and if it takes place in the places that they trust. So I will tell you that we held events in churches, in community-based organizations. We did it at the community colleges, and we also did it in several businesses. This way, we could eliminate barriers to care, such as transportations. We also noticed that the efforts also needed to include staff that reflected the population served and that were able to provide linguistic and culturally appropriate services. If we were in a Latino community, we tried to take Latino staff to serve African-American community. And also when we went up to the north, where we have a lot of American Indian population, we wanted to make sure that we were respectful and were showing the same courtesies. We wanted to provide culturally competent care in line with class. And then we knew that ethnic minority communities were going to say, I don't care what you know until I know that you care. So we were utilizing healthcare entities that are already present in these communities. And so it wasn't a new entity that we were using at the time of sickness or at the time of disease. The fourth takeaway was we wanted to provide a comprehensive approach to community efforts. And so the case for us during COVID-19, this included multiple types of registration. And despite registration, walk-ins were allowed. We all know that in our communities, people will bring additional people when they trust a service. And so we didn't want to detract people from coming in. What we heard repeatedly is that misinformation and distrust was rampant in our communities. And so oftentimes, even within families, there were some against vaccination and others that were for vaccination. And so when we were holding events, oftentimes we would get people that would say, oh, I just snuck away and I wanted to come get my vaccine because my family is against it. And so we wanted to ensure that we had an open door for everyone that wanted it and needed it, both for initial vaccination and then also for the booster. We provided not just vaccination, we provided testing at every one of the events. We provided guidance and education to keep others safe because we know that Latinos are essential workers. We also provided access to care, local providers that were offering visits even during the most COVID dense times. In addition to that, we provided mass distribution, and COVID vaccinations and flu vaccinations were also offered during several months during flu season. And then, like I mentioned earlier, we had multiple modalities for reporting the results. Lastly, we proactively assess the social determinants of health, and we partner with community-based organizations to provide food boxes, utility, and rental assistance on site. We wanted to make sure that we were as comprehensive as possible so that the community saw value add in coming to our events. The fifth one was that we wanted to improve the competencies of everyone in healthcare. As we all know, our provider population and our staff doesn't necessarily match communities worked. And so we wanted to make sure that before we sat everyone down, that everyone understood how health beliefs and core cultural beliefs affect care delivery. Because we know that a growing body of evidence highlights the importance of culturally competent care. And so we wanted people to understand how familismo is going to impact Latino communities. And so we also wanted to ensure that at every event, families are more accessible and more available when the entire family is included and the needs are addressed. And so we wanted to make sure that at every one of our events, there was a component for everyone in the family. This is something that we're currently doing as we're looking to vaccinate the 0 to 5-year-olds, the young population, that we continue to provide services for others in the family. And so those were some of the key takeaways that we learned along the way. Although, like I said, the work keeps evolving as the needs in our population keeps evolving and the waves coming. What I will say lastly is that overall, I think our efforts show how providers are in prime position to inform and advocate for the kind of policies, processes, and programs that can improve health equity while improving COVID, and that I just hope to be part of more efforts like this in the future so that we can shape our healthcare system. Thank you.
Dr. Rios, you're muted.
Thank you. I just wanted to say thank you to all the speakers, and if you could put your cameras on. We are here until the 15 minutes after the hour. So let me just start with a few questions. Everybody here talked about partnerships, and let me just ask about partnerships, and let me just ask Denise if you can comment on the partnership with the church. It was mentioned in the questions about the importance of using community-based places where Latinos go, and we all know that there's very much religious and spirituality to our Latino communities, but nobody really focused on the church. Denise?
Yeah, the question that was posed in the chat had to do with, did we partner well with the church? Were we in agreement and supporting each other? Or were we at odds? I think the experience in Colorado may have been more at odds than in agreement. We were fortunate that the Archdiocese of New Mexico really aligned with the governor. So when we locked down, the church said, we really need to protect each other. So we're not going to have church in person. Do this because you love one another. And we'll find solutions to maintain our connections to God. And then when it came to vaccines, there was still support for go get vaccinated. We may not have done a lot of campaigning to do vaccines within churches, within the Catholic Church, because that's what the question was. But they were very supportive, and they remained very well aligned with what the delivery systems were doing, as well as what the state was doing. So the partnership with the Catholic Archdiocese was a positive one.
That's good. Dr. Frisbie, could you tell us more about the Catholic Church partnership in Colorado?
Yes, we have more than the Catholic Church. We have been doing association or collaboration with one organization, which is Servicios de la Raza. This is a very, very known, for sure you know them. And that was founded by Corky Gonzales. And actually there is libraries with his name and everything. And it's the son, Rudy Gonzales. And Corky Gonzales, I think, was doing work with the farm workers, with Cesar Chavez, and all these people. That was a very, very strong group of people working for a long time, and they're very well known in the community here. And they work with the Chicano community, but they also work with the Hispanic community just coming to the United States there. And they have one doctor, which is funny because we didn't come together, but he's working there, and we went to the same med school. And when he knew I was doing this job, we met each other, and now they're working with the Mexican consulate. And because I was close to the Mexican consulate, and we are working together, Servicios de la Raza, Mexican consulate, and all the public schools in Colorado, because I am doing the liaison between the Colorado Department of Public Health and Environment, because I'm the speaker in Spanish for them. And I put all together these pieces, and then we went to Denver Public Schools and all the school department, and we are able to go to the schools and do Zoom conferences and everything. And that's the way we have been working. And when they ask to have more vaccines, we send the mobile unit. Dr. Ricardo Gonzalez is going in the mobile unit to these places to give the vaccination. And that's the way we have been working.
Oh, that's great. Let me ask about a quick question to Trini, Dr. Solis. Did you use smartphones with your campaigns with, the digital divide? You mentioned the digital divide, but I think someone asked that question.
Well, so it really depended in like in the areas where we were at, because I mentioned in some rural parts of our county, there really is no broadband access. So even if you did have a smartphone, if it's not working, if you don't have much service out there, it's not very helpful. But again, we had some community-based organizations. If that happened, and even if the hotspot wasn't working, then there was always like a backup plan. And even if it was like paper and pencil, and then they'll take it back to their office and fill it out there, because we want to make sure we're also HIPAA compliant. But there is always a strategy as having backups. But with smartphones, it's tough because there's also like language barriers. So we refer individuals to go to the California website, which here in California is myturnca.gov, but it can be difficult to navigate. So I think there's various issues. And so our community-based partners really helped us navigate that and educate the public. So yeah, I'll share them.
Okay, so another question was about media. You all mentioned the importance of educating communities not only through community-based organizations, but through media and multimedia. You all mentioned the importance of traditional media as well as digital media or social media, as well as the Latino media. The Latino newspapers are alive and strong, and they are on websites too and multimedia. But could you tell us, did you have any planning for a health communications campaign? And if you had, or if you have done a specific planning for the campaign, what were lessons learned for others to know about their campaigns for Latino community to make them more effective? Anabell, yes.
Sure. Dr. Rios, one of the things that we learned early on is that social media was riddled with misinformation, right? And so in order to educate people, we had to fill the void. The right information has to come out. And so I will tell you that in this coalition, quickly, we devised a plan that it was going to be multimodality. So we were taking advantage of TV and radio and print, and we were doing it in different languages and bringing different people so that the message was amplified in the community. The more we, the less we did, the more it seems like the misinformation was winning. And so we did a very a specific process about every week and several times throughout the week, there were specific messages that needed to be done. And I'm trying to remember in my mind at this point, but there were some specific to prevention, some specific to vaccination, some specific to ensuring those that have already received. And so we had a cadence as to how this was going to go out into the community. And I will tell you that we did not relent. I think we need to continue to do some of that, and we need to continue to do it for other disease process and other conditions as well.
So let me just follow up on that. For the planning of a health communications campaign, what's also important is that you collect metrics. Can any of you talk about the metrics? Trini, for example, you said you were part of Univision and others, part of your own radio, TV, newspaper, or your partners, other doctors, other hospitals. Were there any metrics that you all shared, and did you realize that it was easier to collect metrics doing certain things, or working with the TV stations, for example, and getting them from them?
Well, I can start and share that. I think it is important to share metrics, but I also found that making them personable, like there's like a face, a person behind that statistic. And so when we would have vaccination events, for example, at a packing house, sometimes it can, there were 500-600 employees there. We would release we would do a press release and invite the media to come, but also respect the person's identity. Like if they didn't want to be on camera, no problem. But just so the community can see, oh, there's 500 people choosing to get vaccinated. And even right now with now that young kids are being eligible to get vaccinated, I think it's powerful to hear it from the community themselves, or like from pediatricians and so forth. And so we recorded a few parents after they vaccinated their kid, and like what message would they give to their friends and family. So I think statistics are important, but also making them personable, like the story, the face behind them.
Well, the only reason I ask is because we're talking here on strategies to really improve the vaccination rates in hotspots that are obviously very hard to reach populations. All of you have told us great stories of what you had to do, but we need to document so that others know how to see the improvement and the trends, and what worked or what didn't work, maybe what messages works and what messages don't work. So that's an example, Trini, of having a face and having testimonials. So that's great. Anyone else on the comment about media, the strategies that you learned through your communications?
Yeah, Dr. Rios, I think that what Dr. Solis said is just so important. There's so much misinformation out there in social media that we needed to get up there to compete against it, so that if we were silent, they were just going to be amplified. So we needed to speak up. And so every time we had something flare up, like ivermectin, for example, or issues with pregnancy, then we specifically set up our video blog that we would do on Facebook Live, and we would plant questions that were appropriate for whatever was going on at the time if the community wasn't asking those questions. And
Right.
so we were able to get out there, and then we used that media then, as well as our press conferences that were organized between the state and the delivery systems. So it would have 4 medical directors speaking at every one, with all of the media invited, both print and TV. They would take lift outs from that to be used for the rest of the week throughout the print and TV media to share. So it helped to spread the information so it could focus us, who were, you know, Vesta and I are both pulmonary critical care physicians. So it could give us enough time where, you know, we just spent an hour in a press conference, and then all that information gets lifted out and shared for an entire week, so that it's not us spending a whole week sharing information.
Right. So another question, I think, again, how do you actually find the hotspots in your community? Hector, you were connected to the health department in Colorado and also with the clinic.
Yeah, exactly. In the clinic, I can speak with the people, and they tell me what their questions. And of course, I started asking for them before the vaccines came on board, before when everything was a question, and I continue doing in-office visit, of course, with mask and all this, not having more than 1 people in the office and people waiting outside in their cars, like it was in 2020, 21 at the beginning. And also, let me tell you about this using the media. Let me tell you, I have been doing, I have been the speaker for Univision, Telemundo, CNN, Bloomberg for maybe 25 years. And I'm pretty well known on TV. And what I do is sometimes going to Arizona, Nevada, Florida, here in Colorado, New Mexico sometimes. And I can identify what the people is asking in these different communities. And let me tell you what was surprising. I do also YouTube presentations for some news of the influencers in YouTube. And I discovered that a lot of immigrants, they still have their heart in Mexico, and they listen to this news in Spanish from guys like Vicente Serrano, Meme Yamel, all these kind of people that they're doing news, but in Spanish. This guy Serrano is from Chicago, the other ladies in Mexico, Puebla, all of these places. And I talk with them about health issues once a week. And it's funny because I start receiving a lot of phone calls from people from California, from Nevada, from here, from Colorado, that they knew me because I was in the news from Mexico, and they learned that I was in Colorado because they saw the flag in my back from Colorado. And they say, oh, you're in Colorado. We didn't know that. But of course I do that. And that was great because they go to the clinic and they start talking with me. And thanks of that, now I am actually Twitter recognized me as an influencer. I have 30,000 people following me in Twitter, and I do a TV program which is named in Spanish Dr. Frisbie Responde, which is on Saturdays on my channel in YouTube. And that's the way I get contact with the community, which is taking a lot of time because doing a TV program is time consuming, but I really enjoy to get in contact with people.
Great. Denise, you wanted to mention how you in New Mexico actually use more scientific methodologies to identify hotspots.
Yeah, we were very worried about equity, Elena, in identifying patients who may be at risk and who may not receive care, both for therapeutics as well as for vaccination and hospitalization. And so we had a partnership with Sandia and Los Alamos National Labs, our delivery system and analytics organization, and the NMDOH, so that we can map high SVI, social vulnerability index, populations by zip code across the state, and then show who's getting services, therapeutics, infusions, remdesivir, vaccines and who's not, so that we could shift our resources to address those high SVI areas where they're not getting services that they should get. So that was a pretty fantastic thing to have those two labs help us. And we developed a pretty robust predictive model so we could anticipate how many hospitalizations we would be having, how many ICU admissions, how many vents would be used. And it was a very accurate model. We needed it because we had so little of all those resources.
Oh, that's amazing. I think it's important to know how much public health and health planning is involved in all of these, especially this preparedness activities, and which we know it was a crisis and an emergency. Nobody had ever even thought we would go through this again, like we did 100 years before with the Spanish flu. So let me ask another question, and this was just I think about the farm workers and the employers. Trini, I think it's very good. Everybody talked about comprehensive approaches in your own areas of the country. But when it comes to the farm workers, were the families vaccinated? And did you approach the issue of just like somebody mentioned about, we always know that families come into the doctor's visits, right? But you mentioned working with the employees and working with the employers, but what about the families?
Yeah, that's a great question. And we did encourage the employers to, also consider vaccinating not only the employees, but the family members. So we did have some farmers on the west side that of our county that did that, and they did it on like a Saturday. That way, the wife, the kids, they weren't in school. That way they would be more available to come. So some of them held it on Saturdays, and we had our medical partner go out and do it. And some farmers told me that afterwards they hosted lunch. Like this is one farmer who got 100% of his employees vaccinated, which is very impressive. But I think, creating that culture of safety, we value vaccines, really made a difference. So I think those employers that vaccinated families had higher vaccination rates. So we as the health department, we encouraged that, and some farmers and employers did it. But if not, we did make vaccination events available at nearby community centers on Saturdays, evenings. So if an employer wasn't offering that, then they can do that like on a Saturday. So I think towards, the last few months of the pandemic access, we really, as Dr. Gonzales was saying, we wanted it to be equitable. We wanted to make sure that it was not only in schools, but in like community centers and in rural areas, in case some employers couldn't do it. So just wanted the community to have options.
And Dr. Sandoval, I know you've been quiet. Do you have any insights on how to get your fellow doctors in New Mexico to get involved? And let's think about the future. We have, the National Hispanic Medical Association has chapters around the country. We actually have one in all of your states except for Colorado. Dr. Frisbie, you're going to be volunteered to help us. But for Dr. Sandoval in New Mexico, we've been a longtime partner with the New Mexico Hispanic Physicians Association. In fact, Dr. Conchita Paz is one of the founders of NHMA, and she was the president in 1994, the year that we incorporated. And we have gone back and have had our campaigns with the doctors. But we do different campaigns. Our Vaccinate for All campaign is our campaign for families to get vaccinated. That's why we call it Vaccinate for All, or Vacunas para Todos. But what do you think it'll take to get more doctors to be champions like all of you are?
Well, I would say that in New Mexico, we were fortunate in that we really had a very strong support across the board from many, many physicians. And I think that probably one of the areas that helped us the most in some of these really small, rural, federally funded clinics, those physicians had such tight relationships with their patients and such trust with their patients that they were able to really get a very high percentage of people vaccinated, just those one-on-one conversations with their trusted physicians. So, I think that the future of health in New Mexico really relies on the physicians moving forward and being able to, as we talked about earlier, trying to branch out and what have we learned from
Mhm.
COVID? What have we learned from having these large vaccinations? What can we do in the future to help with other health issues that are facing the community? So, again, that's the future, and
Yeah.
we will work together to get there.
And I want to say the same for the nurses. I know, Anabell, you were the president of the National Association of Hispanic Nurse, and I know we've talked about the importance of working together. And let me just ask you a different question. How can we help motivate our members, from the nurses, the dentists, the doctors, the pharmacists, the Latino community, the professional community? People do not realize how few we are. And if we can motivate as many of the members of our associations as possible, we can help amplify the message to others in our communities that are not Latino, but who are taking care of our communities. So what do you think is one way that we could work together in Arizona, where you're at, in terms of, our chapters in Phoenix? And of course, we have medical students in 5 different medical schools in Phoenix, as well as in Tucson. And there used to be a Hispanic Center of Excellence there. I don't know if it's still there, but Dr. Carmona is there, Richard Carmona, our Surgeon General. So how do you think we could work more closely together in where you're at in Arizona, or nationally with NON and NHMA?
I will tell you, Elena, we're very lucky here in Arizona in that we work very collaboratively with NHMA and NON. We work very well together. Ricardo Correa, as you know well, and Petra Fimbres, who is leading NHMA here in Arizona, we work very well with the National Association of Hispanic Nurses and the Latino Strong Foundation and others. So I think we've developed a very unique recipe here as to how we can come together as medical entities to really impact population health. I think one of the things that we need to do, Elena, is I think we do need to collaborate more closely at a national level. I'd love to see NHMA, right, and NON and the dentists come together and really do something else on Latino health equity, because I think it takes the voices of these 3 professions and the others that might want to join us, right, to really come together and really highlight what's been happening in our communities from a mortality standpoint, and where do we think as providers and as healthcare agents that we need the next conversations to go so that we can make change. I think it's prime time to have dialogue and then to entice action that we know are going to serve the populations that we serve. I look forward to it, Elena.
Okay, well, on that note, we're going to wrap up this session for the National Hispanic Medical Association COVID-19 series, educating our communities and partners and everyone who's been on the call today. We are having other programs in the future. Let me just say our NHMA 26th annual conference will be in Chicago, Illinois, April 27th to April 30th. And the call for abstracts for speakers and for posters will be going out tomorrow. We have a deadline of August 30th, I think, end of the month, couple of months. We're trying to fast track our identification of speakers and posters this year, so that we can, everything's so expensive. We know how expensive it's going to cost a lot of money for people to fly and travel to Chicago. We also have our Vaccinate for All campaign with our new websites that have bilingual information, hispanichealth.info and our vaccinateforall.org. You can register free here to join 200 plus individuals and organizations that we call champions. And they are all involved and invited to be involved in our media campaigns that are multimedia and also working with Spanish media. And our upcoming event will be another virtual briefing, September 17th, again, 7 to 8 p.m. Eastern time. And I'm sorry, not September 7th, September 28th, 2022. Which is the last Wednesday of September. We also have, for any questions, Vito Garrity, Vince V. Garrity at nhmamd.org is our senior program manager and handling the series with our staff. And also a big thank you, and please remember to complete our post-webinar survey. And you will be entered into a $25 Amazon e-gift card And I think that I want to thank everybody again, and I want to take you up on Anabell. We have a Hispanic Health Professional Leadership Network made up of about over a dozen Hispanic professional associations. We have actually been meeting with the White House and with other national leaders over the last 2.5 years with the CDC funding. But I think you're right that we need to meet among ourselves to develop some action plan. But the first action I would say is that we identify not only the leaders, because that's what happens. We identify only the president of each organization, and if they can't make it, nobody else comes. So what we need to do is identify a team approach of having not only your board members, but your student leaders, or your, I'll just say your younger leaders, different generation leaders, so that we pass on the torch with the leadership development that we need to do in our communities. But I do think it's very admirable of all of you on this call are all in private practice. I didn't hear one word about medical education or faculty. I think that's another strategy that we have to think about maybe for the next one. We talk about how we improve the cultural competence curriculum, the social determinants of health curriculum that it's going to take, and more public health type education to the doctors and nurses and dentists who take care of our communities, so that they learn not to be just in their, in their faculty work, working to train, but we need people to treat our communities too. So thank you all for doing what you do, and thank you staff for everything, and let everyone know, that this is recorded. This session is on our website, nhmamd.org, next week, and also on YouTube. And thank you very much again. We'll see you. Good night.